There are a number of examples that I thought would be worth sharing that are coming off of the trials when we talk about it back to the patient. We tend to view this data as aggregate data, but the truth of the matter is we view patients individually. So I thought it'd be worthwhile to share some of the data coming off. This is the folks from Rome who have published a number of cases on this in ECMID last year as well as this upcoming year. And this was a case where they saw a 68-year-old man with myasthenitis gravis who was admitted to the ICU for respiratory failure. Patient had a high fever, chills, tachycardic, difficulty rapid breathing, suspected focus of infection was his abdomen, and he was started on therapy with Marrow and Vanco. It took 41 hours for the conventional blood culture processes to process, compared to 4 hours for the T2 bacterial. In this case, this patient had a number of organisms involved in the septic picture, but some of those organisms, particularly the use of E. coli and Kleb pneumo, were identified early on within a 4-hour window using the T2 system. This is another case, a 77-year-old patient with pancreatic carcinoma was admitted to the ED. Therapy was initiated with piptazo. The conventional modality looked at about 23 hours of speciation and identification. You can see the chain of events that led to the laboratory diagnosis on this. Once again, the T2 system was able to identify partial septic picture in this patient within a 7-hour time frame. There we go. Here's a third case, again from the same hospital in Rome, a 33-year-old with polycystic liver disease, renal disease, sepsis, and a previous history of sepsis. These patients are particularly difficult when we get into the renal impairment of these patients, as everyone is aware. Take 5 days to result in a negative blood culture result. But the T2 was able to identify E. coli signals present in this patient within 5 hours of identification. And these are the types of stories and cases that we look forward to with increased recognition that our diagnostic tools can identify signals that we've been unable to recognize before.